Gentlemen, let me ask you something personal. Have you noticed that your erections aren't as strong or as reliable as they used to be? Maybe they take longer to develop, maybe they don't last, or maybe there are mornings where nothing happens at all, and you just quietly tell yourself it's part of getting older. I need you to stop right there, because what I'm about to share with you is not just about your sex life. These 3 signs that most men dismiss, minimize, or simply ignore after 50 are actually warning signals from your cardiovascular system, your hormonal health, and your nervous system all at once. And the men who catch these signs early and take them seriously, they don't just save their erections, they save their lives. I'm Dr. Emily Carter, a board-certified urologist with over 12 years of experience helping men over 60 reclaim their vitality, their strength, and their confidence. I've sat across from thousands of men who walked into my office believing their best days were behind them. And time after time, I've seen how understanding what your body is actually telling you can change everything in ways these men never thought were possible again. Before we dive in, do me a quick favor. Hit that like button right now and drop a comment telling me where you're watching from. I love connecting with men from all over the world who are taking their health seriously. And if you haven't subscribed yet, now is the time, because every week I share science-backed, no-nonsense health advice specifically for men over 50. Now let me tell you why this matters more than most men realize. After 50, erectile changes don't happen in a vacuum. They happen as part of a larger picture that your body is painting, and most men are simply not taught how to read that picture. The medical community has done a poor job of explaining this connection clearly. So men brush off the early signs. They tell themselves it's stress. They tell themselves it's just age. They tell themselves it'll pass. And in the meantime, the underlying conditions driving those signs continue to progress silently. Think of it this way. Your erection is like a canary in a coal mine. Coal miners used to carry canaries underground because the birds were sensitive to toxic gases long before humans could detect them. When the canary stopped singing, the miners knew danger was present. Your erectile health works the same way. When something changes, your body is not just telling you something is off in the bedroom. It's telling you something is off in the engine room. And ignoring it doesn't make the problem go away. It gives the problem more time to grow. There are 3 specific signs I want you to know today. 3 signs that are almost universally dismissed and almost universally misunderstood. Let's go through them one by one. The first sign you should never ignore is a noticeable reduction in morning erections. Most men know what I'm talking about. That natural erection that occurs in the early hours of the morning, often when you wake up. In younger men, this happens almost every single day. But after 50, many men notice it becoming less frequent. Maybe a few times a week instead of daily. Then maybe once a week. Then almost never. And most men assume this is simply a natural consequence of aging and leave it at that. But here is what's actually happening biologically. Morning erections, which doctors call nocturnal penile tumescence, occur during the REM phase of sleep, when your nervous system is active, but your brain's inhibitory controls are relaxed. They are your body's built-in maintenance system for penile tissue. During these erections, oxygen-rich blood floods the penile chambers, nourishing the smooth muscle tissue and keeping it healthy and elastic. When morning erections decrease significantly, it often signals that the autonomic nervous system pathways responsible for this process are becoming compromised. In many cases, this is an early indicator of declining testosterone, early vascular disease, or peripheral nerve dysfunction, all of which are treatable when caught early. Emotionally, losing morning erections is something men rarely talk about but feel deeply. It's a quiet loss of something that felt like proof of vitality. Many men describe it as the first moment they genuinely felt old, not because of pain or illness, but because of absence. The absence of something that had always just been there. And that feeling, that quiet grief, deserves to be acknowledged. But more importantly, it deserves to be acted on. Practically, here is what I want you to do. For the next 2 weeks, start paying attention and tracking your morning erections. Not obsessively, but consciously. If you're experiencing fewer than 3 per week consistently, that's information worth bringing to your doctor. Ask specifically about testosterone levels, fasting glucose, and a lipid panel. These 3 tests together can reveal most of the common culprits behind declining nocturnal erections. Don't wait for your annual physical. Make the call this week. I remember a patient of mine, Gerald, 68 years old, a retired firefighter who came in for what he called a routine checkup. He mentioned almost in passing, almost as an afterthought at the end of the appointment, that his morning erections had pretty much stopped over the past year. He laughed a little when he said it, like it was nothing. When we ran his blood work, his testosterone was at the very bottom of the normal range, his fasting glucose was pre-diabetic, and his cholesterol profile showed early arterial stiffness. None of these had caused any obvious symptoms yet, but they were all there, quietly building. Gerald told me later, after we got his numbers moving in the right direction, that he wished he'd mentioned it years earlier instead of brushing it off. He said, and I'll never forget this, "I thought I was just getting old. Turns out I was getting sick, and there's a difference." The second sign that men almost universally ignore is inconsistency. Not the complete absence of erections, but the unpredictability of them. One day everything works perfectly, the next day nothing happens. Or an erection begins and then fades before things get started. Or the rigidity varies so much from one encounter to the next that you start to feel anxious going into intimate situations because you genuinely don't know what to expect. Men often attribute this to stress, alcohol, or just bad luck. And sometimes those things are factors. But when inconsistency becomes the new normal, when it's happening more often than not over a period of weeks or months, it's a pattern, not a coincidence. Biologically, consistent erectile function depends on a precise cascade of signals. Your brain sends a signal, your nervous system carries it, your blood vessels dilate, nitric oxide is released, blood flows in, the venous valves close to maintain pressure, and the erection is sustained. This entire cascade depends on healthy nerves, healthy blood vessels, and adequate hormonal support working in perfect coordination. Inconsistency usually means one or more parts of this cascade are becoming unreliable. The most common culprits are declining nitric oxide production, which is directly tied to cardiovascular health, early endothelial dysfunction, meaning the inner lining of your blood vessels isn't signaling properly, and testosterone levels that are fluctuating rather than steadily declining. Think of it like a factory assembly line where one station keeps jamming. The product sometimes gets through perfectly and sometimes doesn't make it at all. The solution isn't to work harder at the end of the line. The solution is to find and fix the station that's jamming. Emotionally, inconsistency is often more psychologically damaging than a consistent problem would be. A consistent problem, however frustrating, at least gives you something to work with. Inconsistency creates anxiety, anticipatory fear, and avoidance. Men begin to withdraw from intimacy not because they don't want it, but because they're afraid of what might or might not happen. That anxiety then feeds back into the physical problem, creating a cycle that becomes harder and harder to break the longer it continues. I want you to know that this cycle is real, it is common, and it is breakable. Practically, the first intervention I recommend for inconsistency is focused squarely on nitric oxide support. Start with dietary changes before anything else. Dark leafy greens like spinach, arugula, and beets are among the highest food sources of dietary nitrates, which your body converts to nitric oxide. Add a daily handful of these to your meals. Eliminate or significantly reduce mouthwash use, as many commercial mouthwashes kill the oral bacteria responsible for the first step of nitric oxide conversion. Get 30 minutes of moderate cardiovascular exercise most days of the week, as physical activity is one of the most powerful stimulants of nitric oxide production in the vascular endothelium. These are not small things. These interventions directly address the biochemistry of inconsistent erectile function. Quick pause before we move on to sign number 3, because I want to make sure this lands. What I'm describing is not a performance problem. It is a health problem that happens to manifest in a very personal and sensitive area. Every man who has experienced this deserves a doctor who takes it seriously, instead of brushing it off as normal aging. If your doctor has dismissed these concerns without investigation, find a different doctor. You deserve better than that. The third sign, and this is the one most men get completely wrong, is reduced sensation. Not the complete loss of sensation, but a subtle decrease in the intensity of physical feeling during sexual activity. Things that used to feel intensely pleasurable now feel somewhat muted. The experience is still present, but it's turned down. Like someone quietly lowered the volume without you noticing exactly when it happened. Men almost never bring this up on their own because it's difficult to put into words and even more difficult to admit. They worry it will sound strange or that the doctor will dismiss it. But reduced penile sensation after 50 is a clinically significant sign that deserves serious attention. Biologically, penile sensation is carried by a dense network of sensory nerve fibers, primarily the dorsal penile nerve and its branches. These nerve fibers are highly sensitive to two things: blood sugar levels and testosterone. Elevated blood glucose, even in the pre-diabetic range, causes a type of nerve damage called peripheral neuropathy that begins subtly and progresses over years. This neuropathy affects small nerve fibers first, which means sensation changes before any obvious symptoms of neuropathy appear elsewhere in the body. At the same time, testosterone plays a direct role in maintaining the sensitivity and function of these nerve endings. When testosterone declines, nerve sensitivity in the genital tissue tends to decline with it. This is a two-front problem, and both fronts need to be addressed. Emotionally, reduced sensation creates a quiet but profound disconnection from intimacy. The physical experience becomes less rewarding, which reduces motivation and desire, which in turn reduces frequency, which then further reduces testosterone through lack of stimulation. It becomes a slow, quiet spiral that many men don't even consciously recognize they're in until they realize they've essentially stopped being interested in intimacy altogether. And by that point, both they and their partners have been carrying that loss for a long time. Practically, managing reduced sensation requires a two-step approach. First, get your fasting blood glucose tested if you haven't in the past 6 months. Prediabetes is extraordinarily common in men over 50 and extraordinarily underdiagnosed. If your number is above 100 milligrams per deciliter, take action immediately through diet, exercise, and consultation with your doctor. Second, ask your doctor to test both total and free testosterone. Free testosterone, the biologically active fraction, is often low even when total testosterone looks normal, and it's the free testosterone that determines how well your nerve tissue responds. Don't let a doctor tell you your testosterone is fine based solely on total testosterone numbers. I want to tell you about Thomas, 71 years old, a still active contractor who came to me after his wife gently encouraged him to see a specialist. He told me things had been feeling different for a couple of years. Kind of numb was how he described it, but he hadn't thought to mention it to his primary care doctor. His fasting glucose came back at 112. His free testosterone was at the very bottom of the optimal range. We addressed both. We put Thomas on a low glycemic dietary protocol, added resistance training twice a week, and worked with his primary care physician on optimizing his testosterone levels naturally first. 3 months later, he came back for a follow-up and said something that I think about often. He said, "I thought I was just getting old, but I was just getting ignored, including by myself." Here is your simple action plan. This week, track your morning erections for 7 days and make note of the frequency. Book a blood test that includes total testosterone, free testosterone, fasting glucose, and a full lipid panel. Add 1 serving of nitrate-rich vegetables to your daily diet, specifically spinach, beets, or arugula. Get 30 minutes of moderate physical activity at least 4 days this week. And if you've been putting off a conversation with your doctor about any of these signs, make that call today. That's 5 steps. Not one of them requires a prescription to start. Not one of them is beyond what you're capable of right now. And I want to say something directly to you before I close. If you've been frustrated, embarrassed, or quietly ashamed about any of the changes you've noticed, I want you to hear this clearly. You are not broken. You are not less of a man. Your body is communicating with you. And the fact that you're watching this video tells me that some part of you is ready to listen. Even after 60, Even after 70, your body retains a remarkable capacity to respond, to recover, and to restore function when given the right support and the right information. I have seen this happen hundreds of times, not in exceptional men, but in ordinary men who simply decided to pay attention. That decision is available to you right now. If this video gave you something valuable, please give it a like so other men can find it. Leave a comment below and tell me which of these 3 signs resonated with you most. Share this with a friend, a brother, a colleague, someone in your life who needs to hear this but probably won't go looking for it on his own. And subscribe to this channel so you never miss a weekly video where we talk about men's health with the honesty and respect you deserve. I'm Dr. Emily Carter, reminding you that after 50, vitality isn't lost. It's waiting for you to pay attention. Take care of yourself, gentlemen, and I'll see you in the next one.